So we're going to have a fairly quick conversation about how you put financial health really at the start of your, within your business, and how you transform your business to be a financial health business. And Bev, I want to start with sort of this global view of how you, as a fairly new CEO of BECU, think about financial health. How are you approaching this, please?
Absolutely. I think this is such an incredible topic. I'm amazed that there is a conference specifically dedicated to the topic of financial health, and I'm excited to be here with all of you and learn from so many wonderful people in the room. But I think about financial health, and the meaning of financial health is actually quite unique for each individual. But there are sort of two buckets that I like to think about financial health in. The first one, and we've heard kind of themes around this earlier today, the first one is, people want to manage their lives without the stress and anxiety and trauma and drama of unexpected financial issues, needs, challenges. And that's sort of one big bucket. The second big bucket around financial health is people want to have the ability to fulfill their lives in this context of financial freedom. Right. So devoid of all sorts of, challenges. And I think there are, and I think people think about it in kind of three ways. The first is there are people who think about creating wealth and passing that from generation to generation. That's, financial health and financial freedom. There's a second group of people who think about retiring, exactly when and exactly how they want to retire. I'm in that bucket, and that's financial health and financial freedom. And then there's a third bucket of people who honestly are just thinking about how they consistently put food on the table and care for their families. And so those are meanings of financial health that I think we have to think about and care for as we think about serving our communities, our members, our customers on a regular basis.
So how does this translate then into the work of BECU and having that as a center of the business? And then second part of that question is, what's the data that shows that it's working? We're all driven oftentimes by metrics, so how are you showing that the efforts that you're doing are working? So two-part question.
Absolutely. First of all, for those who may not know BECU, we're the fourth largest credit union in the country. Financial health is a part of who we are, a very integral part of who we are, and it starts with our purpose. Our purpose is we bring people together to improve the financial well-being of our members and our communities. So we do that every day. 3,000 people show up to work. Well, they don't show up to work because it's Seattle, so they work from home. Anyway, that's a whole nother panel.
That's a whole other issue.
But they work thinking about the members' needs all of the time. And so the first thing is it's just embedded in what we do every day. However, we recognize that we need programmatic approaches, things that we have to do. So one of the things that I want to talk about is a reprice program. This was something that happened 19 years ago. So back to, this is kind of what we do every day. 19 years ago, we decided that what we wanted to do was thank our customers and congratulate them for progress. Right. So if they have loans with us, they perform as expected, their credit score improves, guess what? We reprice their loans. We take their rates down. And we send them a note and thank them and congratulate them on progress. So that's one of the things, and it's been going on for 19 years. Right? 608,000 member loans, $26.6 million of savings we have put in the pockets of our members. That's the kind of work we do on a regular basis.
Crazy good.
It's amazing. And then a couple of other just quick things, because we wanted to be smarter. So we actually partnered with Financial Health Network, did some incredible data-driven analysis to understand the needs of our members. We used models based upon the measurement framework that Financial Health Network does, and it taught us a lot about the needs of our members and subsegments of members. That led us to understanding gaps in our product strategies. So now we have micro savings products, $12 million of savings there. We have a great partnership. GreenPath was on the other stage at lunch. great partnership around debt management with GreenPath. The one thing that we have that I love are these digital envelopes. So now, I don't know about all of you, but when I was a kid, when I was a little girl, my mom used to have envelopes, literal envelopes. They were letter-size envelopes in the jewelry box, and each envelope had a purpose.
Had a purpose, right?
Right?
Right. Yep.
Everyday money, Mom, I need $5. Go get it, right? Saturday is hair day. We had the envelope with the hair money in it, yep. And then the special needs stuff. So between that and her credit union at the hospital, our needs were managed in the way in which my parents knew how to manage them. Right. So these are the kinds of programmatic approaches, data-driven approaches, always driven by the needs of our members that we try to do to bring financial health and well-being to every single thing we do to support our members.
Yeah, that's amazing. How do you think of moving forward? Because as you just noted, BECU has done this. It's part of their purpose. It's really part of their why. You leverage empathy regularly to really meet people where they are. What's next for BECU as you look over the horizon and you think about continuing to grow what you've done and to really expand the reach to meet all of your members where they are in life and give them that opportunity to financial freedom?
I'm going to answer the question, and I'm looking at the clock.
Yep.
I'm going to answer the question, but I really want to take a moment and talk about the need that we know exists today.
Right.
There's a need unlike any time that we've ever seen, and in the context of financial health for all, I think there are 3 primary use cases that all of us have to focus on. The first need that is prevalent is emergency funds. Over half of Americans cannot handle a $1,000 emergency expense without leaning on a credit card or calling a friend or family member. The second need, or selling something, or making some sort of trade-off that is suboptimal for their lives. Right. The second need is access, and we've talked about this earlier today, the unbanked and the underbanked. It's amazing how many people literally, and I know some of the folks did FinX this morning, literally don't have banking accounts. Or they're primarily using payday lenders, check cashing stores, pawn shops. That need is real, the need for access. And then the third need is home buying, and that's a conversation that we're all having because we are all experiencing the fact that it's really expensive to buy a house today, if you can even find one. 60% of renters believe they will never, ever buy a home. So those needs force us as BECU to think about what else can we do. We've decided that financial health is a thing. It's a big idea. It requires commitment. We've got a committed financial health team. Some of them are here in the room running around. We believe that the opportunity has met the moment. Gen AI is going to unlock the ability to literally embed financial health in the everyday lives of our members, of our customers, in a way that we've never been able to do it. We talk about financial health and we think sometimes it's about education. But many times the way people learn is by doing. And so the ability to put financial health in the path, you're making a decision about whether to spend or not. Imagine if financial health worked like your Fitbit or your Apple Watch with your managing your steps and telling you to stand, right? That's the kind of work that we need to do. Our goal is to find the right partners, do the right work, get the right technology, embed financial health in our experiences, but elsewhere where our members live, work, play, and figure out how to change the game in a fairly fundamental way.
I'm going to go off script for just a little bit, but oftentimes there's a dignity question to that because people are smart about money and they are able to understand without a doubt what they have and what they don't and managing those resources. How is BECU, as you think forward, thinking about that, meeting people with also the dignity of being able to do that. So a little twist on the question of that forward thinking.
Yeah.
Does that make sense?
Yeah, it does. And so I may say it slightly differently,
Please.
which may be provocative. I think people learn how to be smart about money. But it is the one major aspect of our life that we never teach anybody how to do. There's no class. There's no training program. There's no apprenticeship program. You just do. I know about...
And it's shameful to talk about.
And it's
Oftentimes, most people
shameful,
perceive it
especially
that
when
way.
you get it wrong early, and so many of us do. So I think the meeting members where they are, by listening to them and understanding their needs, by looking at a lot of data and letting the data help us guide the work that needs to be done, and asking consent, which we will have to do as we try to assemble all this data anyway, I think that's the only way. And bring them along on a journey. I think when people see that we can actually help in ways much different than the ways we've helped in the past, it's going to be a new game for them and a new game for us. It's totally transformational.
So you've touched upon some of those themes. How are you thinking about that in terms of BECU? If you had to name one or two things that are on the horizon for BECU, please, what would you say?
We're just going to change the industry.
Awesome.
Is what we're...
Well, there you go.
I mean, that's one way I think about it.
Well, there it is.
And you know, and the way, and I say that sort of because I can't help but be a little bit competitive, but the way I mean that is, if we find like-minded partners who are willing to rethink how we do the work that we all do every day. And just a big shout out for credit unions. This is my first credit union. There have been, this nice, wonderful young lady who started clapping first, thank you. 30 years, I heard you on the panel, Patelco, right? Oh my gosh, you could teach me so much about what we do as a cooperative movement. But this movement, this is what we do every day. All of those needs, emergency funds, home buying, access, credit unions provide that to the broadest swath of the Americana than anybody else. And we're super proud of that. Now imagine if we take that work and add technology and embed it and create new capabilities and bring our partners along, the regulators along, the legislators along. Ask banks who have so much more scale to do it too. I think it truly is game-changing. So I guess to answer your question, what's BECU going to do? We're going to start. We're going to start, and we're going to ask people to join us. And we're going to see if we can't figure this out. We think this is the big idea.
That's awesome.
Yeah.
That's awesome. Yep. So for both credit unions, for all of us within the audience, if you had to say and give advice on one or two key takeaways of putting financial health really as the driver of business, what would you say those two things are? Two or three? I'll let you choose.
So I'm going to say that financial health is the driver of democracy. Financial health is as important to human beings as their physical health and their mental health. And financially healthy human beings create financially healthy communities, which create financially healthy societies. And those societies create sustainable democracies. And that is thank you, yes, you can, thank you. That is a challenge that we are all experiencing around the globe. And the only way I think we're going to create some equilibrium is to think about financial health for all. And this is an us problem.
It is, yeah.
And an us opportunity. So we all have to figure out what is it going to look like, what is it going to take. But we actually now have the pieces. You just heard Wamimo up here talking about the data he uses.
Yep.
Gen AI does things that blow our minds. Members, customers, prospects, communities are asking for new solutions. Parents are asking us to teach their kids, right? Everybody's ready.
Yeah.
We just have to do the right work.
We have to be ready too.
We have to be ready
to be ready too.
Exactly. So I love that we're having these conversations. I think the one or two things are thinking much more broadly about our impact around financial health, understanding that we have to reach everyone, because that's actually the only way this works. And we can use the tools and the capabilities and our energy for this work to bring change. And that's what it's really all about.
So as you think about, and I love the way you phrased it, that this is all of us, regardless of which company you work with or what you do, it takes all of us to come together in order to effectuate that vision. That vision feels like solving for world peace. I'm going to use that analogy because it is really big, right? It's huge. And when you think of it and the power that it has to transform individuals' lives, communities' lives, a nation's life, it can feel overwhelming.
Yes.
And so as we think all of us together at this conference focused on financial health, how do you view the future for all of us, and what are those steps that we start to take in order to effectuate that vision without it feeling like, oh my gosh, it's so big, I can't do it because it's too big?
That's a very fair question. I think I get that feedback from my team as well. So I think the first thing is just understanding what need or needs we want to solve first. Like, let's start small. Is it the emergency funds? Is it about access? You know, at BECU, we talk about not only access, we think access is the entry point, but we talk about financial freedom being from access to health, to prosperity, to freedom. Like there's a step, there's a journey that we take members on. And so maybe the first thing is to understand what first journey do we pick up together? And how do we solve that? And what portions or segments of the population do we start with? Because maybe you create the first journey and then you build the other journeys on top of that one. Who are the key partners that help make this easier? As credit unions, we don't have all of the means as maybe some others do, but we certainly know how to partner, and we heard that conversation today. So who are the partners? And then how do we start testing and iterating? How do we just start trying and learning and bringing our member and customer base along? We have to ask them too. What works? What doesn't work? We just did I'll give a shout out to MasterCard. They just did a big sprint thing with us. And we brought members in. And they were like, well, no, that doesn't make any sense. Do it this way, right? And that's exactly what we need to hear. So those are the kinds of things, just one step at a time. Start with the need, start with the use case, create some partners, test it, learn, try it again.
Right. Constantly iterate on it so that you're always testing and learning and moving forward, but not being afraid to start.
Exactly.
That you find something, you find one thing and you start, and then that will blossom into the road ahead. So, ladies and gentlemen, Beverly Anderson, could you please join me?
Gigi, Hyland, thank you.
Thank you so much. It was great.